Alright guys, hello there. It's hopefully this time it's working, and we're gonna play our hospital game for a little while. Welcome on YouTube if you are here, uh, and welcome on Twitch as well if you're watching on the VOD. I'm sorry, it's not streaming now on Twitch, it's streaming on YouTube. So, I think we're all ready. I kind of messed up earlier, so if you saw a notification that I had a stream and then all of a sudden it somehow didn't, how can I say, didn't work the way, then that's the reason, okay? So anyway, without further ado, let's go and load our game. Okay, so we're actually doing fairly well so far. It's 11:41 in the morning. We're gonna have more people in traumatology, but actually there is not a lot. Two people are being dealt with here, and one people I believe is just going to somewhere else. So it's not a big deal so far. We have 3 offices already here in the, what is it? Um, the neurology department, which this is the first I'm actually dealing with. As you remember, it shows that I treated 20 people, actually about 30 people. I'm just waiting for them to like finish up the treatment, so that's not so bad. So let's actually see who is, I believe this is the guy who is waiting for the player. Where are you, sir? And let me double check if there is any other one, just to make sure. Because I missed before, and when I miss somebody, it really ended up a big problem because that person couldn't be treated. So this one, look at that, not so many people in the emergency. Nobody here. Nobody here. Orthopedia, this is the guy, the only person actually in orthopedia right now. And we have nobody here, and I forgot neurology. Perfect, so we can just simply continue going on. Alright, so what do you have? We already know your problem, and we already did physical and temperature, which means basically if you had any of these problems, we would know. We already got some NSAIDs, so we don't need to do a CRP test. Neck palpation would give you diet modification. Huh? You know what? That takes such a short time. Why not? I'm not gonna do a blood test, and it wouldn't work. It wouldn't do anything. So let's just speed up the game. There you go. Okay, and he's already done. Neck palpation. Oh, it actually turned out he did have some dysphagia, or dysphagia, I don't know how to say that, which actually needs some diet modification. Fine. Nothing else we're gonna find out, and this is the correct department, so all I'm doing is let the doctors handle it. Okay, now let's take a look. Hold on, just a quick look. Actually, I can go even closer here. Right there. Oh no, actually, I want to go a bit higher here so that it's not. Gosh, hold on. Right. Okay. Now you guys cannot actually see because my photo is right there. One, I do have a renovation of a nearby clinic causes 40% more patients to come to traumatology. Days left 1. That is kind of covered by all these things. So my actually my camera is slightly too high, but I'm not gonna change that right now, maybe some other time. So forget about it. Okay, so this guy, he is already getting, Christopher Lee is being treated, so we're gonna go to this guy here, who has encephalitis, which is a neurology issue. And we just checked, how many people were in neurology? Oh, 5 of them we have, and Peter Davis is a high risk. We have to take a look at that later. Where's Peter Davis? Actually, let's take a look. Why is it high? Oh, because we just found out that he had hypertension. Okay, so we will have to take care of him in a second. Actually, you know what? I'm gonna even do this right away, so it's getting the attention right away, but that's fine. So neurology, actually, we have not so many people, and here we don't have not so many people, but antivirals, you can give it here as well. You cannot give antipsychotics. It can only be, okay, so neurology, internal, and ICU, which we don't have any of them here. For the hallucinations, we would need to give that. So actually we have to send it over to the neurology. And let's see what else can we find out about him. Physical would give him some pain medicine if necessary. I think we will need that. We already know that he has a fever, so we don't have to worry about that one. Speech listening would give him tranquilizers, so, the patient can talk. Oh, why is the patient can talk? Okay, hallucination, maybe that because of the breathing problems? Okay, that's interesting. I mean, not really interesting, it's pretty horrible. Csf Analysis. Okay, can we do that? We can. How do you do that? Sampling of cerebrospinal fluid is performed by inserting a needle through the lower back into the spinal canal, draining a small amount of the fluid. Oh. Okay, this is really horrible. So, we can do that, but it really sounds horrible. But, right now he cannot talk. What can we do with that? Let's give him some bronchodilators and some antipsychotics, maybe? So that he can actually talk? Wow, this is the first time I see something like that. Obviously, this is what I'm telling you, that I have the new, I opened this neurology department. I've been running this neurology department like automatically by the doctors for a couple of days, but this is the first time I have something like this. That's weird. Okay, ECG is okay, you can do that if you want. But I think I'm gonna do this one as well, but I need to wait until he can talk so I can do a speech listening. Let's see if we can talk after we do this. Wow, this is new for me. So apparently in neurology department we do have some real issues here that we can deal with. Malaria, also says sweat rash, is skin disease common in hot and humid conditions. Okay, that's the simple stuff. We already did that with temperature, physical, so actually I think there is nothing really we can do anymore. Physical, yeah, nothing we can do. You just please treat this poor person. Do we need NSAIDs? No, because it's low. The swollen lymph nodes are low, so this is not something very serious. We don't have to give her that thing. Okay, we know that it's Crohn's disease. That's good. After the CT, basically, because that originally there were a couple of different options. Let's double check, but I think we are done here. Interview, we did that. Physical, we didn't check his shit. Okay, that would give recommendations. It could be medium. I'm not sure if it's necessary. Blood test, it would be a low thing. Blood test, CRP, blood test. Vomiting, he didn't have any vomiting. So if we do stool collecting, 11 for, where would it be? Hematology or what? Require histology lab. Okay. How long does it take? It's only 11:48. So you know what? I don't think that we have used our histology department, histology lab. So let's ask her to do a little pooping there. And let's figure out what's going on. Okay. He's a fish. Fish poisoning also. Oh, itching. Yeah, itching can be a lot. And look at that. We have done a lot of things and we still don't know why he's itching. That is disturbing. So, what should we do? Let's see. If it's emergency, I kind of just have to go through what skin allergy test we already did and it didn't work. Physical, physical, physical. It's all physical. So I'm pretty sure that he doesn't have this because nothing came out from here. This one, physical, physical. Again, it's all physical, I believe. So again, I don't think that that's the problem. Some ear exam we did already. We haven't done odometry. I don't know if we should. You know what? Okay, what else? Interview would find it out. Physical. You guys, you see, this is when it's. I wish I actually knew more about, you know, being a doctor, obviously. So let's do an ECG and a blood pressure, okay? Because this could be serious if that's the case. Now, ECG blood pressure, there are some other ones as well. ECG. This one would have an ECG. So blood pressure thing is also, there are some blood pressure. So let's do an ECG and a blood pressure. Let's do a blood draw anyway. And let's see what we find. I'm really wondering what's going on. Shoulder dislocation, ankle fracture, ankle contusion, knee dislocation, dislocated ankle. Okay, so I'm okay with all of that. But why wouldn't he know that his problem is in his shoulder or ankles? Like, does that make any sense to anybody? It doesn't really make any sense to me. So let's do a physical. And I'm actually going to do a differential diagnosis also. In this case, I'm not sure if it's going to be working or not. Okay, so what happened to you? Nausea, malaise, frequent urination. We already know that you have this problem, which is a general surgery issue. Let's double check again how many people we have in general surgery. Oh, we have a lot of people in neurology. Luckily, we have a ton of people working there, like 3. So it's not that horrible, but look at that. Relatively speaking, we don't have any people here. General surgery, double. So actually, you know what? If I can treat this guy here, this woman here, then I'm gonna treat this woman here. Hey. So let's see if he has a fever. Physical, obviously. I'm not even sure. Yeah, let's do a physical. I mean, we basically do everything that we need to do. It says that I could do a urine test, but I don't even have a urine test here. Oh no, it's an interview. So in the interview we'd find out. Abdominal palpation, that's very simple. Sure. What would the MRI say? Just antibiotics, which we already have. So this one would give him the medicine against fever, that's obvious. Physical would give him some pain medicine. Yeah, that makes sense. Actually, well, that's only take a very short time, so let's just do that. No worries. Daniel Jackson, chest contusion or broken ribs? Let's try a physical and differential on you. We have a chest injury though, which we should do a quick emergency treatment so you are not bleeding out on us or something. Michael Smith, rattlesnake bite. Oh, okay. That's not a happy thing. We do a basic visual test. Sunny! Sorry guys, family. Um, I'm not sure if we need that. We actually don't even have a basic visual test. We only have the, what is it, the ophthalmoscopy, which probably could find out the same thing. Chest, we already, no we didn't, we don't, actually we do have breathing problems, so should I even do anything? I don't think so. I think I'm just gonna treat it as it is. Okay. James Hall, again, rattlesnakes, same thing here. We did have a physical ophthalmoscopy. We did the ophthalmoscopy, didn't come up with anything. Everything is pretty much the same here, other than he has some nausea, but I mean, we don't have any nausea. So let's just do the same thing. Let's just treat this person. Perfect. Okay, this have all eye problems all around. Everything should be, oh no, there are some neurology and there are some internal. So we have to kind of, okay, photophobia is almost sure that we're gonna have a neurology issue here. But let's see first what we can do here. Let's do a physical, let's do neurological. He might have a temperature problem. And let's do ophthalmoscopy. I don't think that anywhere we need an ophthalmoscopy. That would be in basically internal medicine issue, which we would find out anyway if we had a physical and stuff. That probably that's the problem. We can have an angiography if you really want to. Would that help you? You know what, let's just do these first and let's figure it out what's going on later. Somebody just pulled up his zipper so loudly. Okay, so is this bacterial or viral? Basically, that's the main issue what we have here. Okay. All the rest is probably gonna be more or less the same. So, serologic and microbial thing. Physical. Well, anyway, let's do a physical. Let's do a nasal cavity. A temperature, we don't need it. Let's do an ear exam. And a chest. Okay. Dislocated ankle, knee dislocation, or ankle contusion. We couldn't figure it out with a differential diagnosis. Now, do we have do we have to have a CT or just an X-ray? I believe an X-ray is gonna help us out, so let's do an X-ray and we're gonna figure out what's going on. Go back here. Is it the same? No, it's a different. Oh gosh, look at that. Look at this, what we have done here. 3 pages of investigation, checking, and still nothing came up. That is really bad. So I think we have to do something more radical. We're gonna do the angiography. I'm not sure if I need a differential diagnosis. However, I start to believe that maybe we cannot escape getting a tonometry done. Which would be really annoying because we definitely have to borrow some money for that. But if we have what is this? It's called neuroexam unit, which normally is just for hospitalization, which would be on the top. You know, it would be in our hospital area, and I didn't want to open anything like that. I think we need, for neurology, I think we cannot really get away from it. So, you know what? Let's do an angiography, and then if it still doesn't make anything, we're gonna build a neuroexam unit room, and we're gonna actually use it. But for now, let's just do an angiography. Should I also do a microbial sampling? Just in case. Yeah, you know what? We have the time for that, so let's do that. Okay. Crohn. Okay, these are all general surgery, so the place is correct. What are we having here? Crohn disease would be inflammatory bowel disease. Also that this one is just a gastrointestinal disorder, is not inflammatory, so that one wouldn't have a CRP. So I think we're gonna do a physical, abdominal. Let's do a temperature, and I think let's do a CRP. A CRP is a quick little check, basically. And apparently, we don't even need the lab for that. We can do it right here in this place. So let's just do that. Sorry about that. We're gonna do a lot of things on you. Now, this one, we already know that it's the diabetes. I need to do an echo to make sure that he doesn't have AC, he doesn't need an AC inhibitor, because you know what? I had people, well, didn't collapse, but almost. So I'm gonna send her over to the internal medicine, and I'm gonna, since we're already starting, let's do a physical, an echo, and that should do it. Okay? So we're gonna do it in the internal medicine. That's better. Okay, so what do we have? Photophobia. Okay, we found out we have eye pain and red eye when we did a physical exam. Okay, that means that is definitely a neurology issue. Here is the problem though. We have a ton of people in, oh no, hold on, no, neurology, yeah. Not that many. We have 5 people for 3 people for 5 patients. We can actually send him over, that's alright. Basic visual test would be a problem for each of them other than this. Okay. So I'm not sure if I would even want to do that. I am just going to send him over. It's all neurology, right? Yes, it already shows all neurology. So let him go over to the neurology department. We can still do a basic visual test if we want, no worries. Physical basic gonioscopy is just the drainage of this eye. Now the problem is gonioscopy, tonometry would be needed here, angiography probably here, ophthalmoscopy could show this one. Okay, so let's actually do this one quickly first. And we decide later if we need it, because it might be enough, okay? But of course he has to go over to the other department anyway. Alright, what do you have? Nothing turned out here, so no fever, no throwing up and shit, doesn't need pain medicine, doesn't have any problem whatsoever other than being sick. Okay, so let's just... Antibiotics, we can give that here. We don't need to send him over to the other department, so just treat him please, and that's it. Nail fungus or athlete foot? Okay, physical and differential should tell us, hopefully. Okay, chest contusion. We already know that is a chest contusion. Awesome. So we're just gonna treat you accordingly. Okay, you have keratitis bacterial. Nice. So actually, well, not nice, but the microbial cultivation managed to give you that. So we have all the symptoms done. This is the right department, so all I have to do is just get this done. Okay, somebody is collapsing, or at least very seriously sick here. Casey Jackson apparently. Blurred vision. He might have a stroke or something, I don't know. That's the problem, you know. I have this guy and I cannot fix it. I don't know what to do with him because literally I cannot send him anywhere. I cannot do anything with him. Okay. Okay. In the meantime, by the way, where is that? Where's that guy? There was another guy who was kind of collapsing on us, or at least having very serious problems. Not here. Judy Miller. Oh, because he has asthma. Okay, we already know that he has asthma. And what's wrong with you? He is really critical stage. That's not good. And he's still waiting for some people to actually care about him. That's not good. Cold blue, treats this patient with the same priority as critical patient. He is a critical patient. So, I don't know what to do with that. We basically already decided that everything is done with her, so nothing I can do. What else do we have? Anyways, for this one, let's just treat this person. Okay. This person, oh, let's go back here. I want to see who else. Are we having multiple people having some serious issue? Judy Miller, as we said. I saw you. Nobody here, nobody here, nobody here. Oh, actually no patients are here. Okay, so apparently, was it Peter Davis, the guy? Yeah, we already managed his anti-hypertensive medication. So the hypertension we fixed, and now he is all good. He just, of course, needs to figure out what's wrong with him. But other than that, he is not serious. Okay, that's good. So go to this guy, this woman. What do you need? You already have fever. Okay, so we definitely need a physical. And one would be internal. Both of them are internal. How is our we don't have a ton of people here right now, so that's actually fine. We can deal with you. Physical, audiometry. That's an ear exam and an audiometry maybe. Should we throw in a... no, we don't. We do a differential if we cannot figure out what happened to you. Look at that. Physical and differential found that it was an athlete foot indeed. We cannot do anything else with that, so let's just treat it. And we already have over 31 people being fully treated, and that means that we have about 35, 36, or I don't know how many that we actually treated, I hope. So, what do you have? You already have a bacterial tonsillitis, we know that. We didn't have an oral cavity. Okay, and neck palpation. Or nasal. Oh, nasal cavity we did. Okay. I don't want to do that. Basically, the oral cavity or the neck palpation both would show us. Let's do both still. All right. Okay, good. Blurred vision, red eye, and photophobia. It's all neurology, obviously. We still have five possibilities. What we have. Do we do a physical exam at all? I think so, yeah. And I don't know. Like, I'm not really good at, I'm just starting to deal with this. You see, this one again would have that. Hold on. There was one woman. And I kind of messed it up because I don't know which one. There was one that I said if I need to, I'm gonna get a new office, but I totally forgot which one. So that's kind of stupid. Maybe for this one we don't need to. Alright, let's go back here. So, physical, yeah, let's do physical first without anything. Okay, because I don't know what else. Angiography could be at one point if we need to. And of course that tonometry thing. Yeah, let's just do physical and take it from there. Okay, we know what's wrong with you. I think this was the one. Look at that. Yeah, we did angiography, and we said if necessary we do something else. Luckily, it's not necessary, so let's just treat you. Okay. Oh, we have 9 hidden symptoms, and look at how many different possibilities we have. That is scary. Headache. Let's do physical, neurological. Let's do speech listening and a chest. Okay, that's just like a general, let's look at you, what the hell is wrong with you. Okay, this one is clear, everything is done. We have all the symptoms, so we just treat him, or her, sorry. Alright, fever again. Literally we have like probably 100 different possibilities why you can have fever. So let's do a physical, chest. neck palpation is very quick, speech listening, and maybe oral or either oral. Alright, I'm kind of going on a limb here, so I'm just kind of guessing a little bit. Okay, so we don't need a blood test because we already know what your problem is, so let's just treat you. Make sure that we get everything that you need. Abdominal pain, that must be analgesics, that's okay. Okay, okay, I think we got one more. We did get something. We get an eye pain here, so we still have 5. Still the same 5, that's the only problem. Still cannot do tonometry. We can do all the rest, so what else can we have? Physical, physical, physical. Tonometry here. Microbial, microbial. Tonometry. Angiography. And gonioscopy. Now gonioscopy can be done right here. Okay, so I'm going to do a gonioscopy. It can be done right here. I don't have to send him to the CAG room. Okay, and I'm thinking let's just do that. Okay, okay, you are fully cleared. We know everything what's wrong with you. Question is, we cannot have eardrops here. Antibiotics you can get. You would need the eardrops for the swollen ear canal, and it's a medium. So, you know what? You have to go over to the internal medicine, and the doctor has to. I'm gonna diagnose you, and the doctor has to just simply treat you. All right? Sorry about that. And let's see. I think, guys, I'm thinking if I should actually continue now or I should. So 26. I really don't have more time. Yeah, I think I'm just gonna continue this stream, guys. I'm just gonna finish the stream here. I was planning to do 2 short streams, one here and one on Twitch. But I think I'm just because I don't have the time to actually do another stream on Twitch, so never mind. Okay, so we don't need the temperature. Microbial would be just, we need to do that anyway. Laryngoscopy also only gives him antibiotics, so really there is nothing else we can do with this person, so let's just treat him. I always say him, her of course. Urinary tract infection, everything is clear, although it should be general surgery. Let me take a look how busy you guys are. Not really, so you can actually go over to the general surgery, please, and get treated. Thank you. Microwave burn, okay. Traumatology. Do we need anything else? Let's see. Necrosis, yeah, we already did the physical, so he doesn't have necrosis, right? No. Good. That would be a problem. Physical, we didn't see a burn wound, do we? Nope. Blood test, nothing really. Protective dressing if you have desquamation, and we don't. So yeah, we really don't need any of those, so we're just really gonna just treat her. as she is. We don't need to hospitalize her, so that's a good thing. Let's see, pain. Okay, so first do a burn management, and then actually we're gonna do all of these. So she's gonna be really taken care of. That's okay. Okay, so now we are with this guy. We did the gonioscopy and it didn't work at all. So, okay, I think it's 1 o'clock. Let's do a microbial sampling. I don't even think that we need to do an ophthalmoscopy. If I remember well, nothing is showing there. Nothing actually makes sense with that. Can we try differential? Let's try differential and let's see if it works on him. I'm worried that it doesn't, at least not at this relatively early stage, but let's try it, okay? We never, Okay, so this guy already did temperature, basic, ophthalmoscopy, neurological, and it still actually has pretty much the similar issues that this one had. So again, I think we're gonna go for a gonioscopy, and we might go, yeah, let's go for a microbiome as well. I'm trying not to send too many of them because then my lab is gonna be overworked, so we don't want microwave bird. Okay, he is having necrosis though. That is annoying, and that's a high issue. So we cannot start to, okay, physical we already done actually. So we really don't need to do anything. We just microwave burn. Okay, we have to do this and just do all that. I would have started with the debridement, but anyway, whatever, guys. I hope it's not gonna die or, get any more serious. Okay, what do you have? It's a simple poison ivy. We already know that he has fever. Physical eye strap would give an eye strap if he has a swelling. Okay. Steroid, oh yeah, this is important because he might have some rash. So we do need to have a physical. There you go. Do a physical, and then it should be probably a simple open and shut case. What do you have? Acute rheumatic fever, or like a lot of different things, fever and rash. At least we can do something with the physical. By the way, what happened to the guy who couldn't talk? Remember, there was a guy, we wanted to give him the speech listening, and we couldn't because he couldn't talk. I totally forgot which guy that was. I apologize for that. This one is going to the receptionist. This guy is still apparently kind of serious. I don't know. Alright, what do you have? Fever and rash, not rush, rash. Physical exam. Let's do chest. Let's do a speech listening because that's very quick. Neurological, I don't think we have any possibilities for that, do we? Not really. Let's do neck palpation. Okay, because we hope that this is the problem. If it's not the problem, we basically have to send him away. Although some of the things We can treat here in the ER that doesn't, normally another department's issue, so not necessary. Viral tonsillitis, bacterial tonsillitis, or a fracture of the jaw. Okay, that definitely needs a physical and an ear exam. Okay, let's just stop there for now. Okay, because pain in the ears, I'm not gonna check his nose. Okay, let's just say that's all what we know. Poison ivy rash. Okay, we are already for sure. We did everything else, so let's just treat this person. Another poison ivy rash. Again, we know everything. Chest oscillation would help us? Not really. I mean, we already know that you have a breathing problem, so let's just treat this person. As you can see, we are treating a lot of people, so we are definitely over 40 people already done. So it's actually going pretty well if you ask me. Oh, we only have 4 now for this guy, even though it's similar. It's red eye, blurred vision, and itchy eyes. So let's do a physical. Probably physical is the, let's just do a physical first without anything. And then if it narrows it down a little bit, then we are happy, okay? So we know that he has a fever, no need for that. Again, let's just, we can actually, should treat him here. It doesn't need to go necessarily over to the other department, that's fine. Viral tonsillitis, okay, the same person. So ear exam and physical didn't show anything. Aha, that's interesting. So then, let's actually check the temperature. Let's see an oral and nasal cavity maybe. And a check. Chest, okay. Okay, now we are talking. This one only have 2 possibilities. Allergic or inflammatory. One of them antibiotic, one is them antihistamines. So that's actually a pretty big difference if you ask me. Basic visual test is not gonna help us. Ophthalmoscopy, I don't think it's gonna help us. Tonometry would probably help us, but we don't have that. Oh wait, did we do we haven't done a neurology test, so let's do a neurological testing. That would hopefully help us identify which one. Skin allergy test. Yeah, actually, why not? I just realized that I can do it actually in the office. So I thought originally the skin allergy test would have to go to some lab, but you don't have to. Okay, otophagy swollen ear canal. Getting there. I mean, this is a new one actually, not getting there, sorry. Physical ear temperature and odometry. There you go. Pretty much a standard set of things. Maybe too many, but sorry, but oh, another farting girl. I mean, what's wrong with these people? A lot of people are coming here with a lot of farting. Okay, and we already did physical abdominal temperature CT. We have done a CT and a CRP, and he still don't know it. Okay, let's do a differential that only takes half a minute. If he still cannot figure it out, we will have to do some heavy stuff, you know. So blurred vision, he used to have hypertension. Okay. Ophthalmoscopy. we can do perimetry and tonometry. We cannot do either of them. But actually it wouldn't help us too much. I mean, he would get eye drops, what he's getting anyway. A blood test. Angiography would turn out that you have retinal vein occlusion. Okay, he would get these. We could do an ECG. Did we do an ECG? No, we haven't. So an ECG would help us to see if he has an irregular heartbeat. Ophthalmoscopy is kind of important, but we already did, so it didn't help us at all. Physical, perimetry, again, cannot do anything with it. Speech listening, we did that already. Okay. Physical, of course we did. Echo and angiography. Okay, angiography I think we haven't done. So we're gonna do an ECG and an angiography. Which one is better? Okay, I think the ECG is quicker and we don't have anybody there. Actually, you know what? ECG and... No. ECG and echo? Yeah, we're gonna do an ECG and an echo. Over there. And angiography... Can we do that? You know what? We do it at the end if really necessary. Okay? Okay, the fartingle came up with absolutely nothing. So what do we have? One would be... We could check the blood, microbial, or blood, basically blood test or microbial or stool. I don't know which one is quicker. I'm not sure, guys. I wanna have it quickly. It's histology, microbiology. You know what? Let's do both of them. They are in two different departments, so hopefully that's gonna help. Okay, now we know what your problem is. After doing a skin allergy test, it turns out that this is what you have. Now, antihistamines, can we give it to him? Yes, we can. Can I give him everything else? We cannot. Do we need to give him anything else? He is all low. Then we just give it to him and let him go. Because we have a ton of patients still waiting, so we cannot really do anything. Blurred vision. Okay, again, back where we were. Okay, guys, you know what? What I'm gonna do is actually a little bit different. I'm gonna go, I think it's going pretty well so far. We have, let's see, medium. You see, they are not really overwhelmed here. Medium, that's good. So all I'm gonna do right now, because we are really running out of time here for my stream, actually, I think we kind of managed this day already, so I'm just gonna get rid of everybody. Okay. Now it doesn't mean that I can 100% get rid of everybody. I think there are a couple of them I'm still gonna have to handle. But basically, I'm just gonna run the doctors. Let the doctors run from here on. And let's see how it works. Like this one here, he's doing a chest escalation first, then a physical. Didn't really help. We are down to 3 pages. Let's see what happens after. Basic visual, thorax percussion. Okay, what else do you do with this poor guy? Nothing is figured out yet. Abdominal palpation. Neurological testing. Is he just going down literally one by one? It looks like it, you know. It looks like he's just going down one by one. By the way, in the meantime, we already 52 people already treated. That's a good sign. And we have more than 30,000. Now, finally, we have hypertension. It's kind of dangerous. Okay. So can you please help him? Go into chair. Where are you, sir? Don't collapse on me. Being called, okay, just in time. Please treat him quickly. Okay, he's treating her. Oh, she just went to do an ECG when we already know that he has hypertension. That's crazy. Please don't die. Okay, he's going in. Perfect. Complicated diagnosis. No shit. What happened here? And this is the one. First of all, okay. You have hypertension. Okay, so we definitely have to do this. Okay. Second of all, what option do we have? Ophthalmoscopy. I believe we already did. Perimetry and tonometry. We don't have. Blood test. No. Angiography. Okay, would that help us? Definitely would. We already did ECG, it didn't work. We didn't have an angiography. Okay, let's do an angiography, but I hope what happens is, let the doctor try. So first of all, he's gonna give him the hypertensive medication. So he's gonna be like, okay, and then he goes to the angiography. He does have a ton of time though, so I'm afraid we're gonna be late. But that's okay. Oh, there are people waiting here. Okay, it's his turn. Perfect. Where are you going? It's gonna do angiography. Do you have this CRVO? Because that's what the angiography would probably show. Hopefully not a stroke. That would be a problem. Okay, so this guy is not gonna be treated. That's really horrible. At least we know what his problem is. Unfortunately, when he goes to the doctor, he's gonna realize that, oh shit, I have to go home. Okay, so that's not really the best ending of this. Anyway, sorry sir. Okay, I'm gonna just shut you down. I'm not looking at you anymore. Basically the whole place empties out. 76, I don't know if there is any more people. It's already 8:50. I think not 76, 67 patients. I think it's a pretty good day. We have almost $40,000, which of course gonna reduce, pretty much, because we're gonna have to pay out a ton of money. But we made like $35,000, so it's nice. We're gonna have almost 20,000 actually in our bank. I don't know what, oh, we spent 1,000 when we were checking on somebody's hidden characteristics, so that's why we spent $1,000. And we did some building. Okay, look at that, we actually made $15,000. That's not bad. That's not bad, and we have almost 20,000. Alright, let's just go until the next morning, which means that at noon, I mean at midnight, they're gonna just realize that, oh, okay, it's back to normal, right? Yes. Okay, guys, so I'm just gonna finish it here actually, because we've been streaming for, I don't know, it doesn't show, but time is kind of up. So what I'm gonna do is I'm gonna stop it here. Let's actually take a look at yesterday. I hope that we ended up with a prestige. Oh, that's the department prestige. That's not what I want. Can I look like an overall prestige yesterday? Yesterday, no, it didn't. So after midnight, I forgot to take a look. You can take a look, maybe if you know, just look back a little bit. But anyway, we're gonna have 70 patients the next day, and everything is still hunky-dory. So we are doing okay. Yesterday was 100% perfect, so we are doing well. Okay, so apparently it wasn't that dangerous as it looked. We still had like 7 people we couldn't treat, but it is what it is. Okay, so thank you guys. I think what we need to do now, as you can see, we still have to build up a few things. I still need one more department here, which is the cardiology, and I'm just gonna do a little skeleton, just the first floor part of the, what is it, the infectious disease. The infectious disease, I'm gonna treat it later. After the cardiology, I'm gonna make enough money. I'm probably gonna have to grind for a while. Probably just let the hospital run and make money itself until I have enough money that I can open this, plus on the second floor or something, at least like a big yard where I can at least have another like 6, 8, 10 hospital beds or so that if anybody needs any hospitalization, it's gonna go there. And then we're gonna slowly build up the hospitalization for all the other departments. I'm planning to have them in different floors. Obviously, we're gonna have to put a lot of elevators, which themselves gonna need a lot of money. So that's where we are. Hope you guys enjoyed this episode. Don't forget to subscribe, like, hit the bell. If you wanna donate or whatever, it's all up to you. No need, but always appreciated. And don't forget to follow me also on Twitch. If you are watching the VOD on Twitch, um, sorry for not streaming here now, but I'm probably gonna do that tomorrow. Okay? Take care, guys. I see you guys tomorrow or soon. I'm not sure exactly when. Bye.